start? Alright, my name is Whitney Crawford, and this is my head-to-toe physical assessment for the RN to BSN program for NU 359. I have done a complete history of this patient, and now I'm going to do my head-to-toe assessment. She has the right to refuse any of this at any point. Also, all information found in the physical exam will be confidential, as with all of her other patient information. So first, I'm going to start working my way from the head to the toe. So I'm going to start with her head. I want to inspect. I want to do an overall general inspection of the color of her skin, any abnormalities or lesions. I want to look at her hair. I want to make sure that it's well groomed, that it's healthy, there's no thinning or balding places. And then I'm just going to palpate her cranium. Do you have any tenderness or pain with that? Okay. So I have palpated her cranium. There are no nodules noted, no soft spots noted, and it seems to be within normal limits, nice round. The next thing I'm going to assess is her temporal arteries. And they are palpable and regular, as they should be. The next thing I want to assess is the joint, her TMJ. So I'm going to place my hand back here behind her mandible. I'll get you to open your jaw and then close. And it is normal. There is no popping or crepitus noted when she closes her jaw. The next thing I'm going to do is I'm going to be assessing cranial nerve 5 and 8, which I'm going to get you to raise your eyebrows. Okay, I'm going to get you to close your eyes, squint your eyes. There you go. I'm going to get you to show me your teeth. Okay, I'm going to smile, frown for me, puff out your cheeks. Okay, and then I'm going to get you to clench your teeth together. And I'm going to hold your teeth clenched. And I'm going to pull down, and she does meet resistance upon that. I'm also, at this time, going to note, of course, any abnormalities with the head assessment. That completes the head. I'm going to move into the eyes. I'm going to look at the external appearance of the eyes. I want to note, are there any obvious signs of redness, draining, bruising, any abnormalities at all. I want to next just assess her cranial nerve 2, which is visual acuity. So I'm going to get her to come, and we've marked 20 feet. Okay. I'm going to get you to read the lowest line that you can.
D, E, F, P, O, T, E, C.
Okay. Very good. And her vision is 20/20, as that was the 20/20 line on the Snellen chart. So we assessed cranial nerve 2, which is visual acuity, with the Snellen chart. The next thing that I'm going to be assessing is cranial nerves 3, 4, and 6. And that is pupil reaction to light. I want to make sure they're reactive, equal, and that they also provide with accommodation. So first, I'm going to just note that her pupils are round, they are not irregular, and that they are equal at this time. Then I'm going to, with each eye, I'm going to use a pen light. I'm going to move into the field of her vision. This pupil did constrict with light, and this pupil also did equally constrict. So they do react to light. The next thing I'm going to do is I'm going to assess for accommodation. So I'm going to hold an object in front of your face. I want you to look out at the wall, and then look back, and then look out, and then look back. Very good. Okay, and so that is her eyes do dilate with distance and constrict with closeness. So that is within normal limits. That's what they should do. The next thing I'm going to assess for is extraocular movement. I'm going to get you to hold your head still, but I want you to move your eyes with my marker, okay? Very good. And her eyes moved in each field without moving her head, without any deficits or sluggishness. So her eye exam with the cranial nerves are within normal limits. The next thing I want to do is notice her eyelashes and any other external deformities. Her eyelashes are normal. There are none missing. The next thing I want to do is just look at her conjunctiva. So I'm going to pull down your eyes a little bit. Her conjunctiva is moist and pink. There's no yellowing or redness noted, no dryness noted. There's no drainage, and her sclera is normal. Her iris is normal, and there doesn't appear to be any abnormalities with the eye assessment. The next thing I'm going to move into is the ears. I want to note if there are any outward on the external ear, if there are any abnormalities or obvious deformities. There are no lesions, no skin deformities. They're both normal skin color. The next thing I want to do is assess cranial nerve 8. I want to assess her hearing. So what I'm going to get you to do is, with the whisper test, I'm going to get you to occlude this ear. And I'm going to whisper a word in this ear, and you just tell me what that word is, okay? That was the word, and now I'm going to get you to hold that ear. And that was the word that I whispered in her ear. The next thing I'm going to do is use a tuning fork to perform the Weber test. And what I'm going to do is I'm going to bump this on the wall. I'm going to hold it in the center of your head, and you tell me if you can hear it equally, okay?
I can't hear it.
Okay, we're going to do it again, okay? Did you hear it? It lasted longer that time. Okay, the next thing we're going to do is the Rini test. What I'm going to do this time is I'm going to hit the tuning fork, and it's going to sound, and I'm going to place it back here. You tell me when you can't hear it any longer, and then I'm going to move it in front of your ear, okay? Can you hear it anymore?
Stop.
Okay. I'm sorry. Okay, good. And that was within normal limits. So her ear assessment was within normal limits, and that completes the ear assessment. Next, moving into the nose assessment. I first want to notice, are there any external abnormalities or deformities? Her nose is midline, it's symmetrical, it's not displaced to either side. The skin is fine, there's no lesions around it. I want to look and check and see if she has a deviated septum, which she does not. Her septum is midline. The next thing I want you to do is I want to check the patency of each nostril. So what I'm going to get you to do is close one nostril and inhale. There you go. And then do this one, inhale. There you go. And that is normal. Both nostrils were patent. The next thing I want to do is palpate the frontal and maxillary sinuses. So I'm going to palpate around, and you just tell me if you feel any tenderness or pain, okay? Any pain with that? And that is within normal limits. So that completes the nose assessment. The next thing I'm going to do is assess the throat and mouth. I just want to look at the outward appearance of the mouth first. I want to notice, is there any cracking or drying of the lips, any blisters or lesions, which there are not. The next thing I'm going to do is get a tongue blade. And I just want to, I'm going to get you to open your mouth there. And I'm just here assessing for the buccal cavity. I want to make sure the mucosa is moist, not dry, that it's pink. I'm looking for any lesions or sores. I'm also looking for any decaying teeth, absent teeth, or dentures. The palate, any abnormal odors at this time. Then I'm going to assess for cranial nerves 9, 10, and 12 at this point. I just want to make sure that her uvula is midline and that when she says ah, it should move as it's supposed to. Okay, I'm going to get you to stick your tongue out. Stick your tongue out, babe. There you go. Say ah. There you go. And her uvula does move up and down with ah, and upon that assessment, I noted her tonsils. She has tonsils that are normal. They are not inflamed, red, or irritated looking. Also, I want to stick your tongue out one more time. Oh, sorry. The gag reflex. There it is. I'm sorry, dear. Okay, and then I want you to stick your tongue out at me. There you go. And it is symmetrical and without sluggishness or defects or anything. And that completes the mouth assessment. And hers is within normal limits. I'm sorry I had to gag you. The next thing we're going to do is move to the neck. First, I just want to inspect the neck. I want to notice, is there any signs of bruising, lesions, any abnormalities at all? And there's not. The skin tone, any deformities noted, and everything looks good. The next thing I'm going to do is check for lymph nodes. So I'm going to, just going to assess, and I want you to tell me if you feel any pain or tenderness. Okay. Do you feel any pain with that? And there was no swollen lymph nodes noted. Everything was flat. There was nothing enlarged whatsoever upon that assessment. The next thing I want to do is check your carotid pulses. Okay. So I'm going to do one side at a time. I'm going to assess this side. And then I'm going to assess this side. My stethoscope is a 2-in-1, so I use the same side for checking for bruits. So I'm going to check for bruits as well. And there are no bruits noted, which is normal at this point. I'm gonna, at this time, we'll get you to drink just a little water, Ani. I'm just gonna get you to hold it, don't drink it just yet, okay? And I'm going to check her trachea and her thyroid at this point, so I'm gonna come behind her. And I just wanna make sure everything moves symmetrically and is midline. Okay, drink your little water. And everything is midline. The thyroid moved and everything moved up and down as it should when she swallowed. That was normal. There was no deviation noted with the trachea or the thyroid there. The next thing I'm going to do is test cranial nerve 8. I want to check her range of motion. So, cranial nerve 11. I want to check range of motion. I want to have you do chin to chest, and then back, do your head back, and then I'm going to need you to do ear to shoulder, ear to shoulder. There you go. And then we do side to side. Okay, and then I'm going to get you to look this way. All right, and push against my hand. Good. All right, and then look this way. Push against my hand. Good job. Okay, and this completes the assessment of the neck. Okay, the next thing we're going to do is assess the posterior chest, thoracic area. So, let's see what I'll do on this side. So, at this time, I'm going to just look and inspect the back area. I want to make sure everything is symmetrical, that there are no obvious lesions, and that everything is moving equally, and there are no obvious abnormalities. The next thing I want to do is I want to check for symmetrical expansion. I'm going to get you to take a deep breath in, out. Good, and everything moved as it should. It was symmetrical. The next step is I'm going to check tactile firmness. What I'm going to do, Ani, is I'm going to place my hands on your back. I'm sorry, my hands are cold. And I'm going to work all the way down. And as I move down, I want you to say 99. Okay? All right? Okay. And that was normal. I didn't notice any congestion or rattles whenever I was feeling and palpating all the way down her back. The next thing that I want to do is I'm going to percuss over her back. And everything sounded normal upon percussion. I didn't notice any abnormal sounds or any deformities or abnormalities with the percussion. The next thing that I want to do is I'm going to percuss upon her flanks. Ani, I just want you to tell me if there's any tenderness or pain when I percuss, okay? And this is assessing the kidney area. When I test the flank, because I'm assessing for tenderness and pain in that area. Do you notice any pain? Good, good, good. So that is within normal limits. The next thing I'm going to do is I'm going to assess and auscultate all breath sounds. Okay? Take a good deep breath in for me. Good, blow it out. And all breath sounds were normal. There were no moist, wet, crackles, wheezes heard, so everything was within normal limits. And that completes the posterior chest assessment. The next thing I'm going to do is do the arms assessment. So first of all, as with anything, I just want to inspect. I'm going to look at both arms for bruising, lesions, skin rashes, dry skin, obvious deformities at all, and there are none noted. I want to test and check and see if I can palpate pulses. So I'm going to start with the radial. And it is present and palpable and regular. Going to do the ulna. And it is regular and palpable. and then brachial. And it is regular and palpable. And I'm going to do the same thing to this arm. The ulna. And then the brachial. And all pulses are equal, without deficits. They're regular and palpable. The next thing that I want to do is check for capillary refill. I want to check her nail beds. They are blanchable and they return within less than 3 seconds. The next thing that I'm going to do is assess for reflexes. Okay, just hold your arm. Did you come in? Yeah, was that it? And then we're going to do brachial. Is that it? Did you feel it? Did you feel it that time? Okay. And then tricep. Okay. And her tricep did move this side. Alright, and we're going to check radial. Did it move? It jumped. Okay. Did you feel it? Is that it? Okay. Alright, and then the tricep area. And her tricep did jump. Okay. After the reflexes, I want to test for range of motion. So what we're going to do is I'm going to get you to do your arms above your head. Alright, then hyper extend. Alright, and then bring them back out in front of you. And you go abduct. There you go. I want you to bend your elbows and then back out. Alright, and I want you to bend your elbows back up against me. Good. And then push out against me. Good job. Alright, I want you to hold your wrist out. Go up. Flip them over. There you go. Back. Move them all around. Good. Open your fingers up. Touch each finger with your thumb. There you go. And that's testing the cranials. And then the cerebral function, I want you to touch your finger to your nose. There you go. Finger to nose. Good job. Good job. And her range of motion was within normal limits. The next thing is I'm going to be testing for sensory perception. I'm going to get her to close her eyes. Get you to close your eyes. Hold out your hands. Okay. And I'm going to get you to tell me what's in your hand. A ball. Very good. Okay. Tell me what's in this hand. A key. Very good. All right. I'm going to get you to close your eyes one more time. Hold out your hands. I'm going to write a number in her hand, and she's going to tell me what that number is. 3. Very good. 4. Very good. So she did, her sensory perception was very good. And that completes the upper extremity assessment. The next thing we'll be doing is going into the anterior chest part of the assessment. So what I'm going to do is just get you to lay down on me. The first thing I want to do is just notice any asymmetrical movement with the breath sounds. With the breath movement, I want to note is her breathing labored? Is she struggling to breathe? Does each side of the chest rise and fall equally? And it does. Her chest is symmetrical. I don't see any abnormalities or deformities. I'm looking for any lesions, bruising, anything like that. And she is very normal. The next thing I'm going to do is listen to heart sounds. I'm going to start with aortic valve. I'm going to listen to the pulmonic. Tricuspid and mitral. All heart sounds were heard, and my bell is built in, so I don't have to flip over to hear any abnormalities. There were no murmurs heard. All heart sounds were abnormal. I heard S1 and S2 along with the auscultation. The next thing I want to do is feel for point of maximum impulse. So I'm going to get you to your arm out then. And I can feel hers. She does have a pulsating there. No thrills, no heaves. And that completes the anterior chest assessment. The next thing we're going to do is assess the abdomen. Okay. All right. The next thing, when I first look at the abdomen, I want to notice the contour. Is it distended? Is it flat, round, any hardened areas at all? And it's not. She doesn't have any lesions, any bruising noted, no obvious signs of deformities or abnormalities. The next thing that I want to do is make sure that I first auscultate, percuss, and then palpate, as that's very important when you're doing an abdominal assessment. The next thing I'm going to do is I'm going to assess bowel sounds in all 4 quadrants. I'm going to start in the left lower quadrant. Sorry, it's cold here. I'm going to move in a counterclockwise manner. And while I'm here, I'm also going to assess for her, I'm going to listen to renal and aortic arteries just to make sure I do not notice or hear any bruits. And I do not. Also, her umbilicus is introverted. It's normal. There's no hernias noted in this area whenever looking. The next thing I'm going to do is percuss each quadrant in each area. And that is within normal limits upon percussion. All quadrants sound normal. The next thing I'm going to do is palpate. I'm going to start with light palpation, moving in the same direction that I auscultated in. And then I'm going to move into a deeper palpation. Okay, any tenderness or pain there? No. And that is within normal limits. The next thing is, last thing is, I just want to feel on this side, make sure that her liver is not enlarged, make sure I can't palpate that, make sure there are no nodules or masses that I feel, and there isn't. So her abdomen is within normal limits upon this assessment. Okay. All right, here. The next thing we're going to do is move into the legs. I'm going to assess the leg. I just want to note any bruising or abnormalities, any obvious deformities, which she is within normal limits. Her skin color is good. I don't see any sores, lesions, anything like that. I want to first assess for the popliteal pulse. Okay. I'm going to move to the posterior tibial. And the dorsalis pedis. And they are palpable upon assessment. Get this side. Okay. Posterior tibial. And dorsalis. And they are all regular and palpable. The next thing that I want to do is assess for range of motion. I want to notice that she can move properly. I'm going to get you to bend your knees here. Just bend your knee at a 90-degree angle. Get you to bend it up just like that, okay? All right, knee to chest. There you go. And then I'm going to get you to do this leg the same way. Good, okay? Take that knee out and then bring it back in. There you go. And do the same with this one. Take that knee out and then bend it back in. There you go. Now I want you to do your legs like this and back together. There you go. Abduct and adduct. Then I want you to flex your feet for me. Point your feet and then flex them back up like this. There you go. All right, then I'm going to hold against you, pull them up. Good, and then press them down. Good, good. So her range of motion is within normal limits. At this time, I want to test for cerebral function. I'm going to get you to take your heel and I want you to run it down your shin, okay? Good. All right, and the same thing on this one. Good, good, good. And then I also, while I've got it let down, I want to check for Babinski's. And her Babinski's is not positive, which is normal. So at this point, I'm going to get you to sit up, sweetie. Okay. I want to check the popliteal and the Achilles reflex. There you go. There you go. Okay. Then I want, turn that way just a little bit better. I'm going to check the Achilles tendon. Just relax your foot. Okay. And her foot did bounce. Okay? And then turn back that way just a little bit. There you go. Foot did twitch. Okay, so that is the Achilles and popliteal reflexes. The next thing I'm going to do is have her stand up. Get you stand up then. Okay, I'm going to get you start over there, and I want you to walk on your heels for me. Okay, and then walk back on your toes. Very good, very good. I want to test the Rombergs. So I'm going to get her to close her eyes. Close your eyes. And I want you to stand with your arms out. Feet together, arms out. And there's no swaying noted with this test. She can stand balanced and straight. So that is normal. The next thing I want to do is test and see. Just hop on one foot for me. Good. And then the other. Good, and she's able to do that without complications, so that is within normal limits. The next thing I want to do is just notice her spine. I want to notice, is there any obvious abnormalities? And there's not. I don't see any bulging of the spine or any deformities at this time. Okay, I'm going to get you to bend down, touch your toes. And I'm going to feel, and it is straight, and there's no deformities. Okay, turn back up. There you go. I'm going to get you to go side to side. There you go, and then bend side to side. There you go. She was able to complete that without difficulty. I didn't note any abnormalities with her spine during that movement. She is within normal limits. This does complete my physical head-to-toe assessment for NU 359. Thanks.